Hi, everyone, and welcome to today's webinar. My name is Cindy, and I am the Multiple Myeloma Education Manager here at HealthTree. It means a lot to have you join us as we continue growing HealthTree's myeloma community. At the end of today's webinar, we'll have a short survey where you can share your thoughts on today's session and suggest topics you'd love to see in the future. We're always looking to cover what matters most to you, so we'd really appreciate your feedback. Before we dive in, I want to take a moment to introduce HealthTree Foundation, especially for those of you joining for the first time. HealthTree is a global nonprofit dedicated to supporting blood cancer patients in three key ways: providing personalized education and support, creating meaningful patient-to-patient connections, and offering a powerful patient data portal called HealthTree Cure Hub. We truly believe that informed patients help drive better and faster cures. All of our resources are completely free and easy to access with a single HealthTree account. Just a heads up, this meeting is being recorded and is also being live streamed to YouTube. For those of you joining from YouTube, welcome. We hope that you enjoyed today's session. And if you have any questions about HealthTree or what we talk about today, you can find us at healthtree.org. After the event, we'll send a link to watch the recording to everyone who registered for the event and any resources we mentioned straight to your inbox. You can also find the recording later on our website. As we go along, feel free to drop your questions in the chat. We'll keep an eye on them. Our presenter will answer all audience questions during the Q&A at the end. If you need help with any Zoom features, just let us know in the chat. We're happy to assist you there. To access the chat, click on the chat icon. If you're on a mobile device or tablet, you'll need to tap the screen and then click the chat icon to join the conversation. As always, we'd like to thank our sponsors without whom this event would not be possible: Adaptive, Johnson & Johnson, GSK, and Amgen. I'd also like to thank Pfizer for their generous sponsorship of Multiple Myeloma Awareness Month and for supporting this webinar. With their support, we hope to raise awareness of multiple myeloma and help others like you find community and answers to their questions through HealthTree. Every March, our community comes together to raise awareness, share powerful stories, and support those affected by myeloma, including patients, caregivers, friends, and family. We have a QR code on the screen, which will take you to our Multiple Myeloma Awareness Month landing page, where you can find information about the things we talk about today. This year, we're highlighting the power of collaboration with our theme, From Community to Cures. We invite you to get involved and find your place in HealthTree through one of our 4 initiatives. Share your experience on HealthTree Connect, transform lives with HealthTree Coach, volunteer with our HealthTree regional cure teams, contribute to research through HealthTree Cure Hub registry. Together, we can make a difference. Join us in turning community into cures. We're so excited to hear from our speaker today, who will talk about mental health and multiple myeloma. We chose today's topic because living with multiple myeloma isn't just a physical challenge, it's an emotional one. And it's an emotional one for those that are supporting us throughout our treatment. Many of you have shared emotional toll you face as a patient or a care partner. We want to focus on practical strategies to support your mental well-being. I'll take just one more moment to introduce today's speaker, and then we'll jump right in. Chantal Dreyer is an oncology social worker at the University of Iowa Healthcare. She is responsible for providing emotional and practical support to cancer patients and their families. She's worked in the mental health care industry for the last 14 years and works closely with individuals and families navigating mental health challenges. Chantal earned her master's in social work from the University of Iowa, where she developed a strong foundation in social work and a passion for advocating for the well-being of her clients. With that, I will go ahead and turn the time over to Chantal.
Hi, everyone. I'm gonna load real quick up to the presentation. Thank you, Cindy, for the introduction. There, can everybody see okay?
It looks good.
Okay. So Cindy said, I'm Chantal. I'm a social worker here at the University of Iowa. I am an oncology social worker. Before I did this, I did mental health for 14 years in another setting. So I kind of brought mental health into where I'm working. And it's been a very interesting experience because it's definitely something that is needed in this field. So just kind of to start, the the basics of multiple myeloma, I'm assuming that most of you are well aware of what it is, but just wanted to throw a couple things out there. Multiple myeloma is a cancer of the plasma cells. It's commonly found in the bone marrow, but it can accumulate in any part of the body. Most patients with myeloma, by the time they're diagnosed, it's already kind of spread to multiple sites, which is why it's called multiple myeloma. The median age of diagnosis is about 70 years old. In 2025, there's going to be 36,000 around there new cases diagnosed, which is quite a big number, especially for this type of cancer. All right. This is a quote that I really like. There are only 4 kinds of people in this world: those who have been caregivers, those who are caregivers, those who will be caregivers, and those who will need caregivers. Caregiving is universal, by our lovely Miss Rosalind Carter. This kind of just demonstrates the importance that at some point in your life, you will likely be a caregiver or may need a caregiver. It's just a responsibility that we all have. And then when you partner cancer in with that, it can be very tricky. Who can be a caregiver? I'm also going to bring up a little topic here about support person. Your caregivers can be your spouse, your partner, any of your family members. Sometimes those are your adult children. Sometimes those are aunts, uncles, nieces, nephews. Sometimes they can be someone's neighbor who's checking in on them often. They can be your friends. It can be a group of friends. It can be one really good friend. There are also people out there who have paid caregivers. Somebody that we're hiring through like a home health agency to help us out. But unfortunately, a lot of those things, if you're looking at a paid caregiver, is not covered by insurance. Very rarely do our people have that ability to have it covered for them. And then you're looking up anywhere between $20 to $40 an hour for somebody to come be in your home, which can be quite an expense if it's not something that you've anticipated. So I brought up support person. It is one thing that I have noticed in this field, that there are some people, when they hear the word caregiver, kind of gives a negative feeling for some. And it kind of puts them off to the idea of helping someone when they use the word caregiver. Using the word support person can be super helpful when communicating with doctors, families, anybody. The main difference to note is the difference between that support person and a caregiver. Is when we hear caregiver, it's really somebody who we're thinking is doing 24/7 care, helping with all of our daily needs. Using the word support person allows us to keep our patient to have their identity of they can take care of themselves, that they still want to do as much independently as they can, but they may need assistance. We just see a lot more positive feedback when we're using that term. Kind of the next part that I want to move on to is some signs of patient distress and caregiver burnout. Ironically, they are both pretty similar. So I think it's fair just to include them on the same slide. How do we notice when somebody's not feeling well? Well, they're going to have emotional exhaustion. They're going to be tired. They might be overwhelmed by how they're feeling, meaning they could be angry. They could shut down. They could be in denial. They could act like nothing is wrong. They will walk around and they will pretend that everything is okay. And when somebody asks them if they need something, they will tell them that they are fine. It can be very hard, especially if you're not directly asking somebody how they are doing. And it's okay to identify to them that, hey, I know that you're going to tell me that you're doing fine, but can we have a real conversation as if there's something that you need or that you need help with? People struggle with physical exhaustion. They're going to get tired more easily. They're going to get sick easier. They're going to just, all in general, they might have aches and pains and headaches and all those normal things. So what now? What do we do now that we know all of this? So for multiple myeloma, there's quite a few little apps that can be used on your phone or computer that you can reach out to people. There's the Leukemia and Lymphoma Society, which will be soon known as the Blood Cancer United. There's BMT InfoNet, which has amazing info and education pieces for professionals, for patients, for caregivers. They have tons of support groups that they've opened. There's an app called Cancer Buddy. Cancer Buddy is one where you can log in and they are created usually by hospitals to be as either support groups. You can meet people to have peer-on-peer connections. Same thing with ACS Cares, that's the American Cancer Society. It's an app where you can log in and that you can be connected with a professional or another person, and you can talk about the things that you're struggling with, and it gives you another form of support. I do have those all linked, so if they are to be clicked on, they would go to them. Who do we all have for support? I think sometimes when we talk about those support people, people forget everybody that's around us. We're thinking of just the people in our home. We've got family, extended family, immediate family, friends. We have therapists and counselors. We have our psychiatrists. We have local support groups. They can be through the hospital, the churches, the cancer centers, all those little programs that I just told you for LLS and ACS and all those. One that people don't think about a lot is there are case managers through insurance, especially people who are on Medicare or Medicaid. You can call, and there is somebody on the other end of the line that will help you, and they can be like, hey, you might need this resource. Let's see if we can get you connected with it. Not enough people use those, and they're very good. You have your healthcare team. You should be reaching out to them. Hey, I'm struggling with this. They're going to probably connect you with a social worker, and hopefully they can get you an idea of some of the things that may be offered. Now, local support, it might seem a little funny for journaling, but sometimes your support can be yourself. Sometimes you can write down your feelings and you can talk about them and safely communicate them on your own. Not all the time do you necessarily have to reach out to someone if you feel like it's something that you can manage. There are crisis lines that you can call. I did link some of the numbers over on the side. The suicide crisis line is over there. There is also a wonderful website called www.findhelp.org where you can go in, type in your zip code, and it will show you tons of different resources for housing, transportation, different types of fun about everything you want. I do think it's important to note, support groups don't just have to be cancer related. Sometimes you don't necessarily want to talk about things. Sometimes you want to go and you just want to enjoy yourself. Coping skills is one of the next things that we want to use. Please enjoy my lovely picture from Jamaica that I took, because I think we all need a nice sunset and a beautiful sky there that's bright orange. Coping skills are those strategies that we're using to help manage stress in difficult situations. It involves both cognitive and behavioral efforts to handle the demands of the situation that are perceived as taxing or exceeding one's resources. So long story short, it's the things we do when we're stressed to make us feel better. This is something that I spent 14 years teaching kids, so it was very interesting being able to switch and then use some of these same strategies with people with multiple myeloma and other cancers. It's important to know, just use the skills that you have. It doesn't have to be anything out of the pocket. It doesn't have to be something that you spend big money on. I'm going to go right back to journaling. Write down your feelings, your worries. It's a good place to write down your questions that you want to take to a healthcare provider or a professional. It's very easy to forget things, whether you're a patient or a caregiver, about questions you may have. So it's awesome to have things that you can write down. Write down the small moments. I want to know what made you smile today. I want to know who sat with you and talked to you at the dinner table. I want to know a joke that you heard, even if it was looking out the window and you saw the first cardinal of spring. Talk with your family and friends. It is very well documented that the more support that we have, those are the people who do better. We want to continue to open those bridges. Work on a hobby, start a new one. Maybe you were doing gardening and with multiple myeloma, it's not something you can do because you're immune compromised. So now you have to come up with a new hobby. What if you draw flowers? What if you start doing Lego flowers? It can be anything silly. It can be anything important. Make time for yourself. It can be, again, really silly. Take a bath, read a book. Take that time just to sit and be with you. You don't always have to be at the demands of other people and meeting their needs. The next one is probably the biggest one, and I feel like I've preached it a little bit throughout this entire thing, is asking, but also accepting the help. If somebody is offering you help, that means they want to help you. If they're asking, accept it. Be there. Let them help you. Let them guide you. Give that support to them any way that you can. But it's important for them to realize that it's okay to say yes. You don't just have to say, I'm fine. Say yes. I would love for you to come over and help me cook supper. Or yes, I need help cleaning my house because I just can't have the energy to do it anymore. Exercise, keep moving. Keep moving is very important for both patients and caregivers. We need to keep our bodies well and healthy and active, and it gives us a better chance for recovery time if we get sick, if we're being more mobile and moving. It's something that we stress here in the hospital with, physical therapies, inpatient and outpatient. What am I eating? Snacking is okay. Everybody gets snacks. We love the ice cream. We love the cookies. but we do need to be mindful of the way that they can make us feel. Some of those super high sugar snacks, some of those really greasy burgers from, Hardee's and stuff like that, they're maybe not going to set very well with us after a while. Some of those have interactions with medications and we end up not feeling good and we regret it later. So just be kind of mindful of what those snacks look like. It's important to have fun. The world is going to keep spinning. It is okay to remember that it is okay to go out and enjoy things. I also have a link down there to Headspace, which is one of the meditation apps that you can use that help people go through guided imagery, or they have motivational talks, or they just have music. Sometimes we just need a space to be able to process our thoughts. Yoga is a major. If you are still able to physically do yoga, or even modified versions of yoga like chair yoga, or even if it's just some movement of your hands, any of that gets your body moving, helps your body feel stretched. Always make sure you have the doctor's permission, though, if you are not doing well being mobile. Mindfulness activities, coloring. Again, that guided imagery is a really good one. Remember, it's okay to take a break. Sometimes taking a break is the coping skill, right? We're so busy running, trying to get things done, that it's okay to say, yes, I need 20 minutes to sit down and just be here. That is okay. Use the resources that are available to you. Don't feel like you can't use them. For both patients and caregivers, those resources are there for us for a reason. They should be taken advantage of it. You're not harming the system. You're not taking credit for something that's not there for you. Those resources are there for you to use. Outdoors, fresh air. Sometimes it's okay just to go outside and remember what the earth feels like, what it smells like, enjoying the wind in your hair, just kind of going out to enjoy it. Make sure you're still showering, taking care of yourself, brushing your teeth. People have good hygiene, typically feel better about themselves. When we stop taking care of our hygiene, we start to notice that things can go pretty downhill pretty quickly, and then we don't want to go out as much. I think a big thing to remember here as well with practical strategies that we can be using is improving relationships. Our relationships with caregivers and patients will take a hit. So how do we stop that from happening? We communicate, and we communicate some more. But communication doesn't do anything if we're not listening. We need to stop. We need to take a moment to listen to the things that they're saying to us so that we can problem solve and work together. If we just communicate and talk at people and we're not actually working through anything, I don't know how good that communication is actually doing. Share your feelings. So listen to those feelings. Actually sit down, look at a feelings wheel. Don't just say I'm happy, mad, angry, sad. There's a whole wheel of emotions, and sometimes it's good to remember that you need to break it down to an even more, maybe I'm angry, but really what's happening is I'm just upset because I'm feeling lonely. And that's a totally different emotion. So sometimes if you can stop and ask yourself why you're feeling that way, it can help you a whole lot. You can go to family counseling or support groups. Sometimes just eating a meal together to remember that maybe you're still husband and wife, that you're still child and parent. Sometimes just having that normalcy of doing something together is amazing. Remember to show appreciation for both caregivers and patients. Say thank you. Remind them that everything they're doing is amazing. Forgiveness is another really big one. We're going to make mistakes along the way, everybody. Something's going to happen that we're not going to know how to handle. We're going to get angry. We're going to feel sad. Those are all okay. But at the end of the day, you've got to give people some grace. You've got to be able to understand that that is important. Schedule time together if you have to. It can be from 10 minutes to a couple hours. Make sure you're making time for those around you. The last thing I kind of have here is one of the things that also affect both patients and caregivers. Waiting, and waiting for test results, for answers, for anything. Anxiety is a real thing. The worry and anxiety associated with waiting for tests and scan results, or even just any type of information. People really struggle with that, myself included. And I am not in the situation that some of these people are in, and I get nervous for test results. I can only imagine how overwhelming it can feel when you're waiting. Don't panic. Remember, you can get a good night's sleep. You can eat a good meal, because a lot of times people get nervous and they don't want to eat. Make sure you're talking to your support people on the phone, over email, on Facebook, in person. I don't care. Just talk to them. Remember what you can control. You can control how you get the information. Relaxation techniques. Maybe you need to bring earphones so you have music to listen to. Maybe you need to do some deep breathing exercises. Maybe you need to do anything for distraction. Acknowledge your anxiety. It's okay. It's okay to admit that this is hard. It's okay to tell your team that you're having a difficult time. I think it's also important to note if you want to tell a doctor or provider that you're having a really hard time with anxiety before a test, sometimes they can prescribe some medications to help you as well. So it's good to let the team know how you're feeling and to reach out to people so that they can understand. Both patients and caregivers both experience this. Sometimes we get the answers we want and sometimes we don't, and we have to be prepared both ways. There are some sources, otherwise that is what I have for a presentation.
That was wonderful. Thank you so much, Chantal. I know I learned a lot, and hopefully everyone who's joined today or will get to watch this later will gain something from this experience. So we do have some time for a Q&A. So if you have any questions, we do have the ability today to raise your hand and ask the question verbally, or you can type it in a chat, whichever you prefer. Again, just a reminder, this will be recorded and made available on YouTube. So just be aware of that. If you don't want to show your face, feel free to just drop those questions in the chat. So I just wanted to start by thanking you. I loved the reminder that support person is such a wonderful term and such a nice way of making it more inclusive and, making people, I think, feel more comfortable. So thank you for that. I really like that.
Yeah, and I do think it's important to note, especially for like healthcare professionals, that there's support groups online for healthcare professionals as well. I kind of see where people are posting some great resources, which are all things that are available out there. Add those to groups. I know I'm part of an AOSW special interest group, and we have a blood cancer and BMT group. And there are some great resources, and we're working on adding that to a library so that people have access to those resources.
Love it. Thank you so much. And as you mentioned in the chat, we saw a mention of Mercy Medical offering free transportation or reimbursement for trips to appointments. We also had a recommendation of HealthTree Myeloma coaches. We got coaches for caregivers as well as patients. And then also the IMF has a great caregiver support group as well. So just make sure you know where those resources are. And, we try to make sure that everybody's aware of them as well. So we've got our first question here. Steve, if you want to go ahead and unmute yourself.
Sure. Thank you. Thank you very much. Steve Morris from Nashville. Two quick responses to it. I happen to be a recovering alcoholic, and I've been sober for 35 years and very active in the AA community for all this time. I just want to let everybody know that if anybody is in AA, we have and we started a AA group for people, only for people who have or had cancer, any type of cancer. It's grown to 150 people from here and around the world, matter of fact. We meet on Zoom 3 times a week. It's only for patients, no doctors, nobody, only for AAers in recovery who have or had cancer. I'm going to put my email address in the chat. And if anybody wants to, we meet 3 times a week. We get 50 people at every meeting from London and all over the world, all people in recovery who have cancer. I'll put my email address. Just send me an email and I'll give you how to do it. The second thing is spirituality to me was a major component. I'm cancer-free after I was told 5 years ago I had only 6 months to live. I just want to let you all know that every hospital has a wonderful ministerial service. The speaker mentioned that, but it's fantastic if you're in the hospital or in the infusion department. It could be a minister, a priest, or a rabbi. Just tell them in advance you want to, and they'll come and they will pray with you or whatever you want. Just talk to you. It's really, really helpful. The third thing, quickly, UAB Birmingham, which is a fantastic, I have my transplant there quickly, is starting, I think, within the near future, infusion treatment for cancer 24 hours a day, 7 days a week. It's going to be a revolutionary program, I think, next year, so that those of you who work or have families can go on a Saturday or a Sunday or 3 in the morning. Check with UAB when the program starts, but that's, of course, in Birmingham to have that done. But pressure your own hospitals to do that. We have to have infusion, not from 9 to 4. It's ridiculous. Okay, that's for me. Don't give up, everybody. They told me I'd be dead. Here I am, still have a pulse. Thank you.
I appreciate that so much, Steve. And we will make sure we pass on the information about the AA group for cancer patients. I think that's a wonderful resource that patients will definitely be grateful to hear about. The statement here, it says, many free resources and services are based on income. My wife and I both work, so usually we max out the financial thresholds. I've been denied rides, meals, copay assistance due to being just over the income requirements. Going forward, these services should be offered regardless of income. I agree, especially on the ride side. I know there are different options, specifically with the VA. So if we have any veterans on today, that is a good resource. But I'm wondering, Chantal, if you have any other resources for people who might be just outside that income bracket.
Yeah. I know, like, our hospital, we offer gas cards for patients. So if they're talking to us about their need, we do have some gas card assistance that we can offer. There are some grants out there that do not ask about income, and that's not a requirement. You just kind of have to scope them out. They're a little bit harder to find, but they are there. Road to Recovery is also a great option. You can link up there with a volunteer that can help with transportation, or they can give you some information. I know you kind of talked about the free rides, but some insurance programs do offer mileage reimbursement. Some of the private ones do. You just kind of have to ask them about it. Medicaid does offer some free rides depending on which one that you're on. You can qualify for medically exempt, which will also get you free rides. Uber Health has a program that I've had some people use. I'm not as familiar with it, but I do know that some people have used it. It's a lot of digging. We do a lot of, I am lucky to live in a big city where if somebody lives locally, we have a lot of bus options. We have a free public transportation. The hospital can give out bus passes. There are some buses that directly route to our hospital because we're one of the bigger hospitals. So there are just options out there. It does take a little bit to find them. That website, Find Help, that I shared on there, if you go in there, there is a transportation section, and it will show you some options that can cover paying for some of those things, such as meals. And a lot of them aren't income-based. If you take a peek at them, you might have a little payment. I'm trying to think. I know there's a couple Meals on Wheels type resources that are like $5 or $6.
That is perfect. Thank you so much. We have also want to plug real quick the financial coach as well, and also Financial Connect at HealthTree. So if you are struggling or you need any assistance that way, we've got great resources through Connect where you can get connected with either a coach or just another person that has, some information maybe that you may not. It's always wise to just get out there and ask those questions. So thank you so much. I don't see any other questions in the group. Let's see. Okay, you got that comment. I'm just wondering, so I know often when you're dealing with a medical diagnosis or being a caregiver, care partner, our mind wants to figure out the problem and find the solution. And so sometimes we can spiral. Do you have any practical tips to help people who may be in that state of spiraling? Is there anything physically you could recommend, or how can people get ahead of their mind in those situations?
So that's where you're going to, again, have to be really honest with your medical team if you're starting to notice that you're spiraling. For one, is this something that you normally struggle with, or is it new? Write down those questions. If you have questions, write them down. The smallest of question that might seem silly, if you're writing it down, you're going to remember to ask somebody, whether that be somebody from a support group, whether it be a medical professional, or just somebody who might have that answer. It will make you feel better. There are a lot of educational websites out there. I just think people need to be careful because, again, you can get on Dr. Google and you're going to find some of the scary stories. But there are a lot of really good programs through the LLS, through HealthTree, through all of those places where you have people you can reach out to and they can help guide you. I think the first step is just remembering to not feel like a burden, to remember that it's okay to ask for help. And once you kind of remind yourself of that, you can get there. But if you can't, then you're going to kind of take a step back, and that's where you're just going to have to take one problem at a time. What do I need to get done today? First thing today is I need to schedule an appointment. I need to contact somebody to ask what to do. I need to make a list of things I need to get done. Start small. It doesn't have to be major steps every day. It just has to be you're getting through the day. Let's make sure that you're getting everything that you need. And I think that's important.
Absolutely. I think it's important, like you said, just to take each issue or concern one at a time. I found for myself, if I write things down and then maybe rate the things that I need to get done, the most important to the least important, or on those days when I'm feeling completely overwhelmed, maybe listing the easiest to get done and, ticking that off the list. And once you get through that easier thing, sometimes the harder things feel a little bit easier to face. So great suggestions. Thank you so much. Thank you. We do have some resources, of course, that were dropped in the chat. So keep an eye on those, everybody who's joined. I think that's all the questions we have for today. I'm going to give it just one more second in case anybody wants to raise a hand or drop it in the chat. While we're waiting, I just want to say thank you so much, Chantal. It was a pleasure and so nice to hear from you. You've got great information. We will share slides and resources in our follow-up email. So be on the lookout for that. But thank you, Chantal. Thanks. All right. I'm going to go ahead and share my screen. Let's see. All right. So as our myeloma community has gotten bigger, we've been looking at ways to make it feel a little bit more close-knit. So in that vein, we've decided to bring back patient stories again. So we'll take just a few minutes at the end of every webinar to highlight someone from our community. If you're interested in sharing your story, please email me at cynthia@healthtree.org, or just, get in contact. Maybe at the end of a meeting, I'll stay on for a little bit longer. So always happy to hear from you and love connecting. So this webinar, we wanted to highlight Lori. So Lori, if you want to unmute and just tell us a little bit about yourself, we would love to hear.
Hi there. Good afternoon to everyone. I'm calling in from Connecticut, where I live right now. Before I start my story, and I'll be quick, I am a multiple myeloma coach. I'm actually a financial coach for all blood cancers, but I'm also a myeloma coach and especially good at talking to people who are newly diagnosed and people with high-risk disease. I'm not good about talking about palliative care or end of life, and I just figure it's better to speak up front about what I enjoy talking about and what I don't enjoy talking about. So, as I mentioned, I am a high-risk patient. I was diagnosed the 1st of November 2021. I have IgG lambda multiple myeloma. I was diagnosed as stage 2. Although my M spike was not above 1, I did have a lesion that cracked my T4. So it was the pain that identified the multiple myeloma. I do have T414, which is a high risk cytogenetic. Excuse me. And I started right away with induction therapy of KRD, which is Cripolis, Revlimid, and dexamethasone. A very strong cocktail for anybody who may have used it. It knocked the M spike or knocked the cancer out of me within 2 months and practically destroyed my immune system in the process. I had a bad reaction very early on. I think the dose was a little bit too high. I was on 153 milligrams per meter squared, and I was on that only once a week. I would just like to mention parenthetically, I did go and have a bone marrow transplant shortly thereafter. But before I did my transplant, I live in the New York City metropolitan area, and I got 3 opinions from people that are pretty senior in the multiple myeloma community about which course of action to take. And I just want to mention this because I do think a lot of my coachees ask me this question, and I do think that it's very valuable to talk to different doctors. It can be very confusing, but it's good to get input. I did get one doctor who's somebody who's very well known in the field who told me that I should stop all chemotherapy and I should just wait and not do anything and wait until my myeloma came back, and then I should go directly to CAR T. So this is in early 2022, this doctor said that, and that was interesting, very thought-provoking. I decided not to do this. My doctor, who is head of a major cancer research hospital myeloma effort now, said that somebody with high-risk cytogenetics could have additional high-risk cytogenetics when their cancer comes back. So anyway, I say that because I do think getting other opinions is very important. I did choose to go the standard of care route, and I did get a stem cell transplant June of 2022. At that time, I had 7 cancer cells per million in my body. My doctor said the objective is to get rid of all of them, and don't know if that precisely happened, but I did go into remission in the fall of 2022 as maintenance therapy because I was a high-risk cancer patient. I did take Revlimid and Velcade, 1 milligram per meter squared at the time. After 2 years of being stable, I dropped the Revlimid this past summer, and I'm on now only Velcade of 0.7 milligrams per meter squared. So according to clonoSEQ, I'm MRD negative. I hope and pray every day that that stays that way. But I'm just grateful for every day that I'm not adding new medicines to my regime. So that I can be a little bit more relevant to the conversation we heard, which I appreciated very much. I spend most of my time in the yellow. I'm surviving. Sometimes I thrive, sometimes I'm green, sometimes I'm orange, and when I have to speak with my health insurance company, I definitely flip into the red zone, and I am not kidding about that. And when I get off the phone with them, then I go back to being yellow. I do not have a caregiver. I am a single woman, and I feel like love, support, care, and therapy are like shoes. It's so much better not to have anything than to have poorly fitting support. So that's me. That's what's particular to me. The things that help me, I won't talk about the struggle since we're past 3 o'clock. The things that help me is I walk 3 to 5 miles every day, quantify it by, my Apple phone. I'm not a good eater, but I do quantify that by a great free app called LifeSum. It's green. You record what you eat, and it tells you how much protein, carbs, calories, and fat you had at the end of the day. So I don't want to run too much more since this was supposed to end at 3. But if anybody would like to talk or would like any support or would like to have me as their coach, please don't be shy through HealthTree. I will say giving love is very important to me. Giving support to my HealthTree coachees is really important to me. And I really like getting information from other patients on HealthTree's platform. It's under the community platform. There's sort of like a Facebook-like chat section, and I find that to be incredibly useful. Anybody who hasn't found that yet, please look for it because you learn a lot, and I've learned a lot through that. So I will stop talking, and thank you very much for letting me talk.
Yes,
Nice to meet you.
Yes, thank you so much, Lori, and thanks for talking about Connect. We're going to highlight that in just a few more moments as well. I know we're a little bit past the hour, but thanks for sticking around with us, you guys.
Thank you.
And thank you again, Lori. That was wonderful. So we'd like again to thank our sponsors, Adaptive, Johnson & Johnson, GSK, and Amgen. And again, thank you to Pfizer for sponsoring Multiple Myeloma Awareness Month and helping us expand our reach. As Lori mentioned, we do have our social media platform. It's called Connect. You can find it on HealthTree. Nice thing with Connect is you don't get bombarded with all the other things that make social media a little bit tricky nowadays. So you can get in there, connect with patients, connect with other care partners, and just talk about the things that are important to you. So we will share a link in our follow-up email so that you can join Connect, and we'd love to continue the conversation there. As a quick note, as you leave the session today, we'd appreciate you taking 2 to 3 minutes to fill out a brief survey about your experience. The survey will appear as a pop-up once you close out of Zoom. This helps us tailor our efforts towards topics that are most meaningful to you. We have several upcoming events during the month of March that I'd like to highlight. This Wednesday, the 26th, our AL amyloidosis and regular myeloma groups are just going to be learning about why early diagnosis matters and how research can help. At the conclusion of that meeting, we'll also have a patient navigator on to answer any questions about HealthTree Care Hub and how to connect your records and different things like that. So it'll be a good experience for anybody who'd like to join. Thursday, March 27th, our Black Myeloma Health community is going to learn about integrative approaches to optimizing quality of life during cancer care. I think that's going to be a really good meeting to join. Monday, March 31st, we do have our last installment of Myeloma Monday. It's another tech innovation, so sign up for that if you have the time at 2 p.m. Eastern. And then later in the evening on Monday, March 31st at 6 p.m., we will be hearing about managing myeloma with bispecifics in real-world insights on access, side effects, and care. So the link to sign up for these events and many others, including the opportunity to learn about HealthTree regional care teams, can be found at the bottom of the slide and will be sent out in this webinar's follow-up email. And again, I just want to say thank you for being a part of our multiple myeloma community. Your support really does mean so much to me, and I'm grateful to have you here. I've included my email on the slide, so please don't hesitate to reach out if you have any questions, or as I mentioned earlier, if you'd like to share your story during one of our webinars, I'd love to hear from you. And I do truly appreciate each of you and hope you have a wonderful rest of your day and hope to see you again at another meeting soon.